One of the most serious complications is brain stroke. Let us understand the details of brain stroke from Dr. Ajit Suani, the leading neurophysician.
Hypertension is a silent killer. We all know that. What most of us are not clearly aware is that brain attack, that means stroke, is caused to a large extent by hypertension. And one of the most important ways to prevent a brain attack is to control hypertension. Hypertension causes 3 to 4-fold increase in the number of strokes. Strokes are of different kinds, and it is important that we recognize what is a stroke. All of us know that a patient who comes with complete lack of movement on one side has a stroke. But few of us are aware that tingling numbness on one side, just a little bit of clumsiness of one hand, just a little bit of slurring of speech, these are also indicators of stroke. And we have to be aware of this because the earlier that you treat a stroke, the better the chances of survival and the better the chances of recovery. Strokes may be TIAs, which means transient ischemic attacks, which are basically warning signals to us that in the future a full-blown stroke may occur, or strokes may come on as a reversible stroke where the patient starts improving within a few days, or it may come on as a full-fledged stroke. But in whichever form it comes, hypertension is one of the most important modifiable risk factor, and if we control that, then we are certain that we can get the amount of strokes down. Now this is one point which I want to emphasize, that once your doctor has started you on antihypertensive drugs, it is very important that without his knowledge and consent, you should not stop them. In fact, if you have uncontrolled hypertension, then your chances of getting a stroke become 3 to 4-fold more than a normal person.
You may be at a greater risk for high blood pressure if you have a history of hypertension in your family, if you have diabetes or kidney disease, if you are a male, if you are over 30 or more, if you are obese, if you lead a sedentary lifestyle, if you smoke or use tobacco, if you frequently consume alcoholic beverages, if you are taking oral contraceptives.
Check your blood pressure now.
If you have hypertension, a physician can help you manage that condition effectively. You can live a normal, healthy life with hypertension. It can be easily managed with medicines and lifestyle modification under your doctor's guidance.